Dr. Marwan Sabbagh. I am the Director of Translational Research at Cleveland Clinical Review Center for Brain Health. Our next conversation is to talk about what makes a great multidisciplinary team in the management of Alzheimer's disease. Practical tips to improve patient journey and outcomes. So there are two types of multidisciplinary teams. One is the interpersonal, that's the right-hand side. The interpersonal team is the patient's caregivers, their family, their neighbors, their neighborhood. Might be day programs in the community. It might be a lot of different groups that help aid a patient with Alzheimer's disease. The interprofessional team might be the doctor, the care manager, the nurse, the social worker, the research team, if there is one, the medical assistant. So there's many people that would be involved in the care of a patient with Alzheimer's disease. So there are two types of teams, and patients and care partners are essential and are included on both sides of this. So establishing a patient-centered diagnosis journey for patients with early stage Alzheimer's disease means that we have to develop a care team that actually integrates many aspects, including increased awareness of diagnosis. So the physician might lead the effort, but the team needs to be aware of what that diagnosis ultimately is so they can help execute on a care plan. The care plan has to be patient-centered and using the integration of the care team. So I'll give you an example. If a patient is living alone, I had a patient was living alone, would wander away from the home. And, after a certain number of times, calling 911, family's like, we can't just keep letting dad just wander away from home. So we had to call in my social work team. We had to get a care plan that had to be executed immediately, talking about short-term placement before we talked about a long-term strategy to get them care in the home. These are the kinds of things you can deal with. And this is the thing, of course, without an integration and a comprehensive care team and a care plan, this causes a lot of stresses and breakdowns. And so strengthening infrastructure to create processes and capacity is needed to create the care teams. A multidisciplinary care team, as I said, should have many elements. It could have social work, nursing, research, physicians, diagnostics, medical assistants, care managers. The care team has to be flexible and has to evolve. Each care plan is different for each patient. I had a patient just yesterday who has Lewy body dementia and wanders every night and sees thinks his family is somebody or other people, sees people in the home and are convinced they're there and sees them, not just thinks they're there, but sees them. And so the family is very distressed. So our care management is about how do we deal with the psychosis, how do we deal with the sleep issues. Another patient of mine is falling all the time and he's huge, and the wife is small and she calls 911 to have him picked up off the floor. These are the kinds of things. So how do we get an environment that's safe for the patient and the spouse? These are the things that we face. As a physician, the care team needs to be adapting patient by patient, case by case, and care plans are unique and tailored to one, not one size fits all, but each individual. There's shared decision-making, which is important throughout the patient journey. Team members need change to reflect the needs and wishes of those with their care of patients with Alzheimer's and their care partners. And importantly, we need to start focusing on diversity and inclusion. Alzheimer's and dementia affects not just non-Hispanic whites, but particularly tends to affect Hispanic, Latinx, and African Americans. In fact, some data suggests that they are more affected. There are substantial gaps in scientific literature regarding population diversity factors related to Alzheimer's. What are the drivers there? And healthcare physicians and scientists are not traditionally trained to effectively partner with diverse communities. And there are few staff from underrepresented groups on medical and research teams. So this is an area of unmet need, both on the patient care strategy and on the medical team strategy. Thank you.